For today's video in the Pharmaceutics video series, we will be showing you how to prepare a chemotherapy drug. For step 1, you are going to properly gown for a hazardous drug preparation, and you are going to clean your hood. For step 2, you are going to gather all of your materials. You will need a 250 milliliter bag of 0.9% sodium chloride, an administration set, 2 EquiShield vial adapters, a vial of your chemotherapy drug powder, a vial of 0.9% sodium chloride injection, an EquiShield spike adapter, an EquiShield syringe, and alcohol swabs. You will also need a chemo preparation work towel to place in your hood. Place all of your materials in chronological order before you begin your work. The arrangement should look something like this. Before you begin preparing the chemo drug, you are going to want to prime the line. Remove the administration set from the bag. Place all garbage to the side of the hood. Remove the plastic covering from the sodium chloride diluent bag. Make sure you are working 6 inches in the hood at all times. Remove the blue rubber stopper from the IV bag. Place the EquiShield spike adapter into the IV port. Make sure you get a tight fit. Close the IV line by rolling down the clamp. Attach the administration set to the EquiShield spike adapter. Make sure the line is pushed completely into the adapter. Hang your IV bag. And open the line by unlocking any of the clamps along the tubing. You will see the solution start to run through the line. Once the solution has run all the way through the line, you can go ahead and lock the clamps to close the line. It's okay if there is a small amount of air left in the administration set. Push the administration set to the side and begin to prepare your chemo drug. Open the lid on your chemo drug vial. Take an alcohol wipe and swab the top of the chemo drug vial and the sodium chloride injection vial. Remove the EquiShield vial adapter. Go ahead and place the adapter onto your drug vial. You should hear 2 clicks. The first is the vial adapter locking onto the vial, and the second is the vial adapter's spike being inserted into the vial. Remove the second vial adapter from its package. You are going to place this adapter on the sodium chloride injection vial. You may have to use force to really push the adapter into the vial. Remove the caps from the vial adapters. Remove the AquaShield syringe from its packaging. Go ahead and connect the AquaShield syringe to the vial adapter on the sodium chloride injection vial. The red lines will line up with the red dot on the adapter. Since this is a closed system transfer device, you do not need to inject air when withdrawing drug from a vial. However, you must be careful when you're withdrawing the sodium chloride. Do not over-withdraw solution, because you will not be able to push the solution back into the vial due to the air pressure contained within the system. Only withdraw slightly more than you need so that you can correct for air bubbles. Remove the syringe from the vial adapter and place onto the adapter that's connected to the chemotherapy drug vial. Inject the sodium chloride into the vial. Leave the syringe on the vial adapter and swirl the mixture. You are now going to remove the amount of drug that you need to inject into the IV bag. Use an alcohol wipe to swab the port on the AquaShield spike adapter. Remove the syringe from the vial adapter and attach it to the port on the spike adapter. Again, the red lines will line up with the red dots on the spike adapter. Inject your chemotherapy drug solution, and to ensure proper mixing of the drug in the IV bag, withdraw some of the solution and re-inject into the bag. Remove the AquaShield syringe. For step 5, you are going to dispose of all of the hazardous waste. Take all of the garbage that's in the hood and place it on the chemo preparation work towel. Remove your second layer of gloves and place them on the chemo preparation work towel. Fold all of the waste into the towel. Dispose of this waste in the proper chemotherapy disposal bin, which is the yellow bin. For step 6, you are going to degown. Before you go back into the anteroom, you are going to remove your outer gown, your hood, and your second pair of booties while you are still in the buffer room. Dispose of these materials in the chemotherapy waste bin. Enter the anteroom and remove all the rest of your gowning.